Hi, everyone. Welcome to the next episode of our webinar series for Cosmetic Laser Dermatology. I have Dr. Douglas Wu here, and he is very excited to be speaking right now about melanated beauty, which is treatment and tips for skin of all colors. So I will give you guys a couple minutes to get to log on and get acclimated with Zoom. But in the meantime, while you're doing that, on the bottom of the screen, there's a little Q&A button, and you can submit any questions there, and he will do his best to answer them when he is done with the presentation. So, all right, Dr. Wu, I think we can go ahead and begin. So I'll introduce Dr. Wu. He is a board-certified dermatologist. He's an incredibly renowned skin specialist, dermatologist, with all treatments such as injectables, lasers, body sculpting, veins. But today he's going to speak about something that he definitely has a special area of expertise in, and that is treating skin of all colors, because there is slight differences about the treatment approach for each, and he's going to take us through and hopefully provide you all with some good education. So thank you, Dr. Wu.
Awesome. Thanks, Risa. And thanks for tuning in, guys. This is going to be a talk really on, what we call in the medical community, so-called skin of color, and the different types of lasers and energy device types of treatments that can be used in this very unique and beautiful patient population. So I hope you enjoy. There are a few things that I kind of want to go over in this webinar here. First of all, I think we need to define what it means to have so-called skin of color. From a medical viewpoint, because it's a very specific definition and one that has been around for decades, and one that all dermatologists and skin specialists use. Second thing I want to kind of really delve into is to understand why these melanated skin tones need to be approached in a very special or unique way in order to optimize the safety and effectiveness of different types of treatments. And then finally, I'll kind of go through some common problems and common concerns that I deal with in my clinic every day, and that many people sort of struggle with, and sort of offer some options and things that can be done to solve those problems. So skin of color refers very specifically to what we call the Fitzpatrick skin type classification. Once upon a time, a dermatologist named Fitzpatrick categorized skin types into 6 different categories based on the color of the skin, as well as based on how the skin reacts to sunlight. And the darker the skin tone, the higher was the Fitzpatrick skin type classification. And so when we say skin of color, we're really referring to the skin types that are 3, 4, 5, and 6. And the reason why these categories were created was because even back then, it was very well known that different skin tones react differently to, for example, ultraviolet light or sun exposure and other types of skin problems and skin diseases. And so this has been a very useful classification throughout all of dermatology, and it's one that we still use today. When we look at a cross-section of the skin, kind of looks like that. And the key here is that layer of what we call melanocytes. These are the color cells of our skin. They're the cells in our skin that produce pigment and are responsible for our skin type and our skin color. These are the cells that respond very uniquely to laser, and they're also the cells that can be targeted by different types of lasers in different types of ways. The demographics of America and of many places around the world is changing. As we can see here, this is just simple census data drawn from the US Census Bureau. And you can see how a variety of different melanated skin tones and populations have been increasing in number over the last several years and are projected to continue to increase. We all know, of course, that we're a multicultural and multi-ethnic society, but the increasing sort of demand placed on us doctors from a medical point of view means that we really have to be conversant with this type of skin so that we can treat it safely and effectively and deliver very good treatments to our patients. This is the basically available from the census data, but of course there are many, many other types of melanated skin tones. We know that these darker skin tones tend to present with slightly different problems. And these include things like melasma, or the so-called pregnancy mask. This is something that is very, very common, whereby, we get benign darkening of our cheeks, usually, sometimes the central face, sometimes the jawline, usually due to hormones, genetics, UV exposure, stuff like that. Sunspots are ubiquitous, and very, very frequent problem in skin of color. And one of the most common things that I probably treat actually in my clinic. It's a colloquial term really for any brown spot on the skin. It could be a freckle or a so-called lentigo, what are called keratoses, and then birthmarks and other types of things. And then finally, acne and acne scarring presents quite differently sometimes in skin of color because of how it darkens the skin even after the acne goes away. And so there's many, many different types of problems that skin of color faces at higher frequency. And this sort of webinar will kind of go through some of those issues. Now, the census data, of course, kind of looks at large populations within the US, including Asian, Hispanic, and African American. But we know, obviously, that skin of color or melanated skin tones encompass such a broad and diverse range of skin tones that a few pictures can never do it justice. But I have treated and do treat, and our entire clinic does treat all of these types of skin tones every single day. And so it's very important for us as sort of medical professionals to be very conversant with that. But what really can lasers and energy devices do for skin of color? Well, it turns out that it can do a lot if you know kind of what you're doing. The three major things that I get, when skin of color presents in my clinic is clear skin. That's always the sort of primary goal. It's the reduction of brown spots and pigmentation, and to make the skin tone more even and the pigmentation more even, okay? A second major complaint I get is kind of smoothing of the skin, reduction of pore size, fine lines, rough texture, things like that. And then a third very common complaint is kind of tightening of the skin, reduction of that sagginess, that little bit of laxity that we start to get kind of in the jawline and the neck, and increasing sort of the lift and the plumpness of the skin. These are very, very common concerns across all skin types, to be honest, not just skin of color, but predominantly so in melanated skin tones. So the one thing that really sometimes prevents my patients from even considering laser types of treatments is because they've kind of done their reading, they've done their research, and they've heard or they've read or they've been told that laser is dangerous for their skin. Okay, and why is this the case? Well, it's actually not. It's actually not a false statement to say that. If we can go back to our skin, what happens when laser treats skin of color is that it actually can potentially activate those melanocytes, activate those color cells, and make them actually produce more pigment and more melanin, which then results in a complication that we call post-inflammatory hyperpigmentation, which is a big long name for just basically darkening of the skin after laser, okay, or after any sort of injury, even a bug bite or anything. It's basically the exact opposite of what we want. And so that's why the common belief is that laser treatment for skin of color is dangerous, and darker skin tones are in fact much more sensitive to laser and therefore more prone to laser injury, laser burn, and pigmentation problems after laser. However, the good news is that we have studied this phenomenon in great detail, and we know a lot of the risk factors that kind of contribute to developing hyperpigmentation. Number one, of course, is the type of laser that is used and the type of treatment that is used. This is something that's extremely important. The right type of treatment has to be applied in the right way. The number of laser treatments also plays a role. You've got to kind of space them out appropriately, and you've got to do kind of your due diligence in terms of respecting the melanated skin tone. The duration of the laser treatment plays a role, and even cooling of the skin during laser treatment plays a role. There's all sorts of different kinds of factors that combine to make treatment of melanated skin tones quite a complex topic, but also one that, if you know the right ways to do it, you can really get a handle on it and really make it nice. So the bottom line here is that as sort of medical professionals and specialists in the skin, it kind of behooves us to really understand the science behind skin of color. And we really have to consider the risks and the considerations when we treat this patient population. And even as a patient, I think it's very important for each and every one of us to kind of understand the uniqueness of our own skin so that we can have a good conversation with our doctor, with our provider, to make sure that everything is moving in the right direction. Of course, we have to use the right lasers. I've selected 4 categories of devices that I commonly use in skin of color, and each of these devices has a certain importance to them and a certain advantage for skin of color. And then, of course, you got to use them in the right way. That's absolutely probably the most important thing. And so what are some common concerns with melanated skin? Well, like I said, there's tons, okay, but I'm going to focus for time's sake and kind of pick out the top 3 that I tend to see, okay? And that's basically pigmentation. So we'll start with that. Pigmentation, brown spots on the skin, some sort of brown spot, and they're often something like freckles, sunspots, that are a bit larger, maybe a little bit elevated, and then there's moles that can kind of spot about the face, and some people don't like that very much. And so here's a situation where, a very common situation where we can see these little sunspots, dotting around the face, and we can target these individually with laser, essentially. And then kind of, you can notice also this sallow sort of skin tone and diffuse pigmentation in many areas. And we can target all of those with more blending types of lasers in order to, at the end of the day, kind of clean up the skin and also tighten up the pore size, the skin texture, and all of these types of things. In this situation here, a skin type 3 patient, very similar concerns with pigmentation. You can see after some laser treatment, these larger sort of spots and then these little freckles kind of in the cheek, they're all pretty much resolved. And the skin is much more even and the skin tone is much clearer. Similarly here, we have some sort of pigmentation issues, but also a faint kind of redness to the cheeks. And that's also a common issue in all skin types, but also in skin of color. And when we combine the right lasers, like a pigment laser, for example, for these pigmentations, and a vascular laser, for example, for these red spots, we can really kind of clean up the skin and make it more even and more luminous. In a skin type 4 patient, a slightly darker skin tone here, we have a Hispanic lady who presents with similar problems with these sort of larger sunspots, but also these tiny elevated little, what we call keratoses, that can also be very nicely treated with laser. And you can see how after one treatment in this situation, most of these spots have resolved and the skin looks much healthier, much tighter, and even the pore size has reduced. This is a young lady with mixed sort of Native American ancestry, and really these tiny little freckles. They're low contrast. They don't really, not really catch the eye, but they bother many people, to be honest. And these are sometimes very difficult to treat unless you choose the right laser, use them in the right way. But when you do that, it's very, very satisfying because they just totally disappear. And overall, again, the skin looks brighter, more youthful, and much nicer. In this situation here, African-American young lady, we would classify this as a skin type 6, and we can see here freckles and pigmentation, and after a couple laser treatments, they've been reduced. Her goal really wasn't to get rid of all of them, but was just to kind of decrease the density of them so that they look a little bit cuter. Men have common problems with pigmentation as well. Again, here's an African-American fellow, what we classify as skin type 6. And again, with a little bit of laser treatment, you can see that just the skin tone is even. It's not that we're lightening the skin. No. We're actually celebrating the skin tone that is existing and just evening it out so that it looks nice. Similarly here, accumulated sun damage, a little bit of a younger male patient here with, again, skin type 6. You can see this dark sort of patchy pigmentation, a little bit more sort of spotty pigmentation here and there. But again, with the adequate laser treatment, even in skin type 6, we can achieve pretty good resolution of many of these issues. Melasma is the other common thing that I see in my clinic. And this is a very special condition, usually presents as brownish to grayish patches on the skin, typically due to genetics, hormones, and sun exposure, and follows certain very well-described patterns, these so-called malar patterns, where you get these patches just to the cheeks. This is probably the most common pattern that we see of patchy hyperpigmentation. The second most common is the central facial sort of pattern where you get this patchiness to the forehead and to the lip, which is really concerning because it kind of looks like a mustache, and it really bothers many people. And then finally, the least sort of common pattern is this jawline pattern here, which we also see as well sometimes in the clinics. And so in this situation here, this lady has developed some melasma and some redness. With a little bit of laser, you can see it's gone. Again, this is a darker skin tone, skin type 4 with a little bit of laser. It's not perfect, it's still kind of there, you can see, right? But it's it's much better. The contrast between the affected and unaffected skin is actually much, much better in the after photo versus the original photo. Similarly, here's a combination of problems, really. There's patchy hyperpigmentation and then these little sunspots here and there. And after a little bit of laser treatment, we're able to kind of tidy that up quite nicely and give just a nicer sort of version of the skin that patients really like. Here's a skin type 4 individual, a Hispanic lady who has this patchy sort of classic pigmentation to the cheek here. And then again, after a laser treatment here, you can see that it's not perfect. It's never or not often going to be absolutely perfect, but at least we can reduce it significantly and then control it after that. And then, Indian subcontinent patient here, very, very common condition as well, this patchy sort of hyperpigmentation. And again, with a few laser treatments, the skin tone is just more even and it just seems to be quite a bit nicer. And then here we have a little bit of a darker skin tone, again, patchier pigmentations. And once again, it kind of resolves pretty nicely with the right types of lasers. Finally, we have acne and acne scars, a really common problem in everybody, really, but in skin of color, it also presents with some unique challenges. And with the acne scar, basically what happens is that the acne causes this loss of collagen and other skin proteins, so the skin kind of indents and divots, and that's really kind of a displeasing appearance to the skin. So, in Asian skin tones, this can cause darkening and pigmentation and stuff, but again, with the right application of laser therapy and other types of treatments, including radiofrequency microneedling, you can get this filling in effect of the scar so that it's just smoother. The scars are still there. You can still see them, but they're much less stark and much less obvious. In a darker skin tone patient, deep scars and, what we call nodulous cystic acne, which is pretty severe, we can see how with the combination of the right treatments, we can really achieve a fairly reasonable improvement. And it's an astonishing improvement in quality of life to be able to control these types of issues. Similarly, with this type 4 individual, a Hispanic man with pretty severe acne, developing sort of scarring and discoloration sort of everywhere in the areas of previous acne, you can see how with a little bit of laser, this improves dramatically. Another sort of Asian individual here with some combination acne scarring, a little bit of radiofrequency microneedling, and the skin tone improves dramatically. It really improves the quality of life and self-esteem for many people. African-American man, again, it's pitted kind of scarring and this hyperpigmentation dotted about the skin type 6s, sometimes some of the most challenging skin types to treat, but also honestly some of the most rewarding because it's such a beautiful skin tone, and to really bring that out is a great thing. And so, in summary, the bottom line is that we got to know our skin. Okay, and that goes to both patients and professionals. By being informed about the unique nature of our own skin, we're kind of empowered to seek the safest and most effective treatments. Melanated skin tones in particular, they face many unique challenges, but are also uniquely beautiful. It's important to find an expert, especially when dealing with skin of color, because complications and injuries in this population can be particularly severe and troublesome. And so it's important to find someone who has some experience with that. So even if you do run into a complication, which honestly, it does happen, unfortunately, although we try our best, at least with experience, we know how to manage these complications to the best of our abilities, and that can mitigate a lot of problems. And then finally, aging is sometimes a choice. Be the best version of yourself and do it in a safe and an effective way. So thank you so much for tuning in. I think we have maybe some time for some questions if any of you have any, but yeah, very thankful for you guys tuning in.
Great. Thank you so much, Dr. Wu. That was really great. And I know there's, not always a lot of good information out there for people with, all types of melanated beauty. So we do have a number of questions here. Anyone else that's on, feel free to submit them in the Q&A now. So let's see, here we go. Is it harder for people with darker skin to get skin cancer and sun damage?
That's a very good question. So We'll answer the skin cancer question first. In general, there are many types of skin cancers that are definitely of lower incidence in skin of color, including one of the most deadly forms of skin cancer known as melanoma. And so the melanated quality of the skin actually is protective of the UV damage that can come with excessive sun exposure. And so yes, things like melanoma are in fact less common in skin of color. In terms of sun damage, it's not necessarily easier or more difficult to get sun damage. It just presents in different ways. You know, for skin of color, sun damage often presents as hyperpigmentation, so brown spots, keratosis, stuff like that. Whereas in fairer skin tones, sun damage might present as fine lines and wrinkles and sort of roughened skin texture. So it's just a different type of presentation that really has to be respected.
Okay, great. Let's see. Are there treatments available to treat eczema on darker skinned patients?
Oh, there's absolutely treatments available for eczema and darker skin tones. This is a very challenging problem because you can get in your elbows and behind your knees and sometimes the full body. And even when eczema goes away, it leaves these dark patches that are unsightly. And so, to control the active inflammation with eczema, there are a broad range of different types of creams and pills that can do it from a medical point of view. And then once that inflammation is calmed down medically, we can apply a variety of different lasers and topical therapies to further blend away the pigmentation. So there's definitely treatment for eczema and it's very effective, or can be.
All right. Which lasers are best for people of color?
Yeah, that's a somewhat of a complicated question, because at the end of the day, almost any laser can be used safely and effectively in skin of color, as long as the experience and the skill level of the operator of the device is at a sufficiently high level. There are a few that I like, and these include the so-called picosecond lasers. And the picosecond lasers are a newer class of laser that have really proven themselves as one of the best types for skin of color. And there are things like radiofrequency microneedling devices, which I really love for skin of color. Vascular lasers are very safe if used appropriately in skin of color. And then there's other things like ultrasounds and other types of radiofrequency devices that don't even see the melanin layer. They act on different molecules within the skin. And those ones are thought to be very safe actually for skin of color too. So there's a broad range, honestly, that can be useful. And it's combining the right treatments for the right person at the right time in the right way, basically, that makes the treatment good.
Great. Okay. Let's see. Are there any specific ingredients in skincare that can benefit someone with skin of color?
Absolutely. So the basic ingredients across all skin types remain things like sunscreens, sunblocks, okay? Retinols tend to be very useful, growth factors, antioxidants. These are common sort of threads throughout all skin types, and they're good for almost every single skin type. Now, for skin of color in particular, the one added layer is the excessive hyperpigmentation that occurs. And so there are a variety of different pigment controlling ingredients that can work really quite well. And it's only a fairly small number, to be honest, that have some science behind them. But you may have heard of things like hydroquinone, azelaic acid, kojic acid, arbutin, and there are a variety of other things. And then the newest, one of the newest ones is an amino acid derivative called cysteamine. And we're constantly trying to push the envelope in terms of our research for these ingredients and trying to package them into elegant skincare solutions. So there's definitely a range of products that can be very useful and unique to skin of color.
Great. All right. Let's see. This is a great one. What do I need to look for in a dermatologist before I let them treat my dark skin type?
Yeah, there are some things that are a little bit personal in nature in terms of, you got to get along with them. You got to feel a good vibe from them. And, you got to be comfortable in their hands, of course. So some of it is personality and things like that. But if you think about it from a medical point of view, there are a couple of things that I always advise, my friends and family to look for when they go see their physician, especially an aesthetic physician. Number one is kind of their experience with the specific problem or with a specific skin type. Okay, it's very important to delve into that and to see how many of these patients that they actually treat. And also, am I still on?
Yeah, we're
Lisa?
just looking at you now instead.
Oh, okay. Right. So, how many of these types of patients they actually treat, and what kind of experience level they have with them? That's number one. Number two is you really should hopefully try to ask them to show you some of their results. If they have treated many of these patients, then they're likely going to have some sort of portfolio, a realistic, undoctored, non-Photoshop, just a good camera set of like photos that you can realistically judge things. And then finally, you have to kind of also look at the types of devices that they use to really determine what's the best for you. And those are kind of the issues that I kind of like to look at. Their training, their background, of course, their qualifications, those are a given, honestly, and they apply to all doctors in any situation. But some of those other issues are quite unique to skin of color.
Okay, great. All right, well, we have made it through the questions. I think some people are being shy today, but that's okay. If anyone has any further questions, Dr. Wu is available for virtual consultations, or if you're comfortable coming in, we've made the office a very safe environment, and he's available for free in-person consultations, complimentary. And you can also follow us on social media and follow Dr. Wu. And otherwise, I hope this was helpful. We feel like there's not a lot of great information out there for people with skin of all shades of colors. So we hope that this helped provide some education. And if you are local to Southern California or the San Diego area, I encourage you to come see Dr. Wu. So thank you so much, Dr. Wu, again for your time.
Thanks, guys. Have a
Oh,
great
wait, we have one message. Thank you for looking so nice on Zoom, Dr. Wu.
Oh, thank you.
I agree. Dr. Wu always looks
Usually in my
amazing.
pajamas, honestly.
All right. Well, thank you so much, everyone, for joining us, and Dr. Wu for your time. And we hope you guys have a great rest of your Tuesday evening.
All right, good night. Bye-bye.
Bye.